Hello, everyone. Welcome back. My name is Cureton, Senior Journalist for XR Today, and we are bringing you the latest and greatest for the VR, AR, and XR industries. Today, we have on, yet again, another special guest making some special solutions for the XR space. So his name is Scott Anderson, Chief Clinical Officer for NeuroSync. And NeuroSync is a very interesting company. I've had a chance to look at the website. Thanks for coming on today, Mr. Anderson. It's a pleasure to see you.
Thanks, Damon. I really appreciate being on and looking forward to the discussion.
Brilliant. Yeah, we have some fascinating things to talk about. So NeuroSync, we're going to talk a little bit about NeuroSync. Tell me a little bit about yourself and what you do as the Chief Clinical Officer.
Yeah, no problem. So again, my name is Scott Anderson. I'm the Chief Clinical Officer at NeuroSync. And really my job is to interface on a scientific level with people that interact with our company. So whether that be scientific exchange around product development. I typically lead our product roadmap and the development of key features and strategic decision making around the types of products that we want to bring to the market that have a market need. And then, coordinating activities to validate those technologies, whether that be through clinical trials or other types of studies. And then through the, I would say, the scientific discourse or exchange with our user base. So most of our users are clinicians or people who are in the medical space. And oftentimes, my support is provided to them to help them get the most clinical utility out of our products. And so that's where I spend most of my time.
Right. Yeah, and that's a very daunting task considering like the way that people use, XR tools and utilities these days. There's a lot of hand and eye tracking involved. So we're going to get into that for our conversation for today with PROSYNC. This is one of the most recent solutions that you've created. So what was your motivation for creating PROSYNC and why did you decide to use sports as one of the first use cases?
Yeah, I think ProSync is an idea that I've talked about or have been thinking about for a really long time. My background is as a clinician working in sports medicine, and so I've dealt with sports-related injuries and sports performance optimization and rehabilitation. In a 20-plus career as a clinician. What I've seen is I've spent a lot of time performing cognitive screenings, both from a baseline level and in a post-injury environment. And what I've seen is, despite the amount of patients that I've had who have, succumbed to these types of injuries, neurological injuries, for example, there's even more broader need, I think, for people who are dealing with cognitive deficits that aren't diagnosable. Their brain is functioning suboptimally and they don't realize it. And in my time, in the development of other products, and in particular our first product, NeuroSync's first product, iSync, which I used as a clinician before we commercialized it. That's one of the revelations that I came across was, look, there's so many people who don't necessarily have an injury or a diagnosable condition, but screening them as a healthy individual, a healthy subject, we see deficits. And so is there potentially ways that we could upskill their deficits and optimize their brain for the demands of their sport? And so I had always wanted to leverage technology for something like that as a clinician, and I never found it. And so, over the last 7 years, I've been really thinking about how do we integrate a solution that allows us to provide real-time measures of cognitive domains, key cognitive domains that are, critical to, high-performance activities, and how do we get them out to the masses, right? So that you and I can know when we wake up in the morning, is our brain ready to do what we want to do? Or, is it risky for us to fly a plane today, for example? It's probably not going to be a good idea based on the amount of sleep that we got, or, the poor recovery that we had, or the amount of beverages we had last night. So, it's one of those things where I think it has utility beyond sports, but certainly sports is where we identified the original need and use case.
Yeah, and I bet like for sports, they want to perform at their optimal speed, agility, concentration, whenever they're doing that. I could see this type of product being used for like the Olympics or for like the NFL or whatever, even the Euros, whoever decides, to kind of adopt it. So I think it's very interesting. I'd like to see what happens in due course for that. We can actually go into the next topic. I'd like to kind of look a little bit about, other use cases that you think would be the most ideal for ProSync. So we spoke about a few of them: sports, everyday tasks and things of that nature. What about other sectors like the military, maybe upskilling and training for the workforces, because that's really a massive vertical that's growing quite a bit.
No question. And I think, this is really where the utility of XR-based technologies and VR in particular, in this case, are really relevant and useful, in my opinion. Due to the feature set, form factor, and the mobility, it's really something that you can deploy anywhere. And where we're going to in all of these sectors, you talked about the military and workplace environments. Everyone's talking about readiness, right? The term readiness, which is, are you prepared to do what we're asking you to do, and can you do it safely? And I think that speaks to the military and workplace environment, whether that's warehouse workers or people that are operating dangerous equipment, from pilots, as I mentioned, to even the executive who's got to be in 3 different time zones in a week, right? There's a deleterious effect on cognition as a result of that. And so I think it's really, and that's part of the reason why we named it ProSync, is it's a proactive tool for kind of understanding risk before somebody does something. And so 100%, I think this is a consumer solution that could be applied anywhere.
Absolutely. I could even see something like this being applied to maybe like an augmented windshield. So when people are driving, and it can actually look at how they're responding to the road environments, as well as, if someone is too tired, it can remind them to pull over and, get some rest.
Yep, and no question. And I think the utility of something like a heads-up display lends itself to continuous monitoring, which is I'm a huge fan of, and I'm really excited about the future technological implications of continuous monitoring of cognition, right? Whereas as of right now, I think some of the limitations around VR and XR in general is that it's has to be put on in order to use. But what if you could use a heads-up display, whether that's mounted in your windshield or even in a contact lens, that can just continuously take measurements and can provide you with a snapshot of that performance throughout your day. I think that's super compelling, and something that I think ultimately we will progress to.
Absolutely, yeah. There's so many use cases that this could go into, and all sorts of branches. So, yeah, I'm excited to see what it can do. I wanted to ask maybe about this. So, say for instance, a lot of people begin to start, deploying ProSync or something from NeuroSync, and they wonder about like the ethical policies that the company's got, or maybe potentially like data privacy issues. Like, what kind of policies have you got in place for your company that would help to like address those?
Sure. Yeah, I think anytime you're dealing with the brain and brain measurements, it can be tricky, right? I think if you're talking about athletes, there's concern about the findings, and potentially those findings getting into the employer's hand and using it against them in contract negotiations. I could see the same thing happening, in a corporate environment with high executives that are highly paid individuals and are expecting a certain level of performance from. Those are things that we take very seriously, and as a result, all of the data that's collected in our system is owned by the end user. We don't have access to it. We don't touch it. Everything that resides on our servers is de-identified and not accessible to us. We make it available to our customers and our customers only. And we've even gone so far as to migrate that data from our cloud infrastructure to their own if they prefer to have it there. I think in the cases of sport, a lot of people have asked me, this could be a really interesting thing to screen prospects or draft picks and things like that, right? And to have a full kind of comprehensive cognitive profile of a player that really doesn't exist today. And teams want that on their servers, right? They want that to go along with the physiological data and the other performance metrics that they capture. And so I think it's really a great question, and something that we take very seriously. And as a result, we give that information back to people and let them do what they want with it, versus us, utilizing it for other purposes.
Yeah, that's very important. I think a lot of people look towards those types of solutions, so that way they can protect data, even if it gets into the wrong hands unknowingly or unwillingly. For example, either a data breach where there's a person actually going in and breaching the data or taking the data, or if someone presses the wrong button and sends it to their grandmom or something like that, and then you have another issue on your hands. But Yeah, I wanted to take it maybe to a philosophical question that, this is something that I like to think about quite a bit when it comes to, human augmentation, certain technologies that are used to interface with, humans in general. So technology, I would say, is one of the primary driving factors for, advancing human skills, human development, and things of that nature. So we had steam engine, we had computers, we had all these things that have made us do things that we never thought were possible in the future. So what are your thoughts on this, and what is your take on like how technology drives human development?
Yeah, I'm actually really glad that you bring this up, and I feel the same way. I mean, I'm just as passionate about technology, and I've seen firsthand as a clinician by training, I've seen technology improve the quality of people's lives, and that's ultimately the point that I come from. Is holistically, I believe that there is a place for technology to help guide us to understand our own health, to take ownership of our own health, and to make behavioral changes and other decisions that really can improve the quality of our lives. And so that's really where I see it playing a role. And ProSync is a really good example of that in the sense that we really don't have reliable technologies that tell us about the function of our brain today, right? I can go get a CT scan and it's not going to tell me much about how my brain's operating from minute to minute. And so, this is really something that I think a lot of people will benefit from, because in the same way that we're using our Apple Watch today to count our steps and to learn about our heart rate and other things, we're going to be able to do the same thing with our brain now, and we're going to wake up in the morning and be able to know should we go do those things, and it's going to impact what we do and the decisions that we make. And so I 100% am in agreement. I'm actually obsessed with the application of technology to improve human function and performance, and I still think there's a lot of opportunities out there that we've yet to discover, but that's the important part is being able to make these discoveries and apply them to the human population, and to see how it impacts our lives. And it's a really exciting time to be a part of technology today, because we have made so many advances, and just in my seat, I see there's so many more to come. So it's going to be really interesting to see what happens, particularly over the next 5 years.
Absolutely. There's going to be like a meteoric rise of new technologies, new solutions, new things, and even new ways to interface with machines. So that way, say for example, when spectacles or smart glasses become a real possibility, they may start replacing the smartphone in ways we never thought were imaginable. But yeah, once again, that was a great way to cap off the conversation. Thank you so much for your time. And once again, we were speaking with Mr. Scott Anderson. He's the Chief Clinical Officer for NeuroSync. It's a company based in Palo Alto, California. My name again is Damon Cureton. I'm Senior Journalist for XR Today. And thanks again. If you'd like to follow our conversations like this, please follow us at the XR News hashtag. You can find us on Twitter, LinkedIn. And thanks again for coming out. Wish you a wonderful day, and until next time.